My mother Shantha, she was actually suffering from knee pain. I mean, this pain was there since almost last 10 to 15 years, and now it had reached such a situation that she was not even able to walk at home. I mean, without the support of the wall or any of us, even at home, she was finding it difficult even to go to the washroom or even to work in the kitchen as well. So that was a time we took a decision that we should go for a knee replacement. And then again, when we decided for the knee replacement, being a major surgery and our age also being a criteria, we were actually really apprehensive about it, whether really to go for a surgery or should we continue with it with the medication and whatever other support therapy. I mean, that is a time where I got in touch with Dr. Harsha through a common friend of mine. I mean, after speaking to Dr. Harsha, that is the time that me and my entire family got the confidence that we should go for a knee replacement surgery, that too both the knees together. In fact, earlier when we had consulted other doctors, they suggested something that we should go for a knee replacement one after the other. So one leg at a time, and maybe after a month or two, the second one. But after meeting Dr. Harsha, he gave us that confidence that both the knee replacement can be done at a time, and also the recovery time is also very fast. Maybe within 15 to a month's time, she should be able to back, walk on her own. Now that it's been 17 days, the surgery has been completed, and I'm happy that even without the walker, she's able to walk on her own. That's the major thing. And one more thing, what I would like to specify here is she is a post-COVID patient. I mean, she was on ventilator during the first wave. In the same Aster RV Hospital, she was on a ventilator for 9 days. In fact, that was a time where doctors initially at the time of admission they had given up the hopes, and the pulmonology team they did an excellent job. And maybe after 9 days, she was able to come out of the ventilator, and now she has become a normal patient. And this is the time that we took an decision for going for the surgery. And thanks to Dr. Harsha and his team, it was a successful surgery. And I would actually recommend, I mean, patients of all our age and maybe even who are elder to them, I will feel that, if you feel that Aster RV would be the best hospital, if at all, if you are planning for any sort of a knee replacement or a hip replacement surgery. Thank you.
ನನ್ನ ಹೆಸರು ಶಾಂತಾ ಮೋಹನ್ ರಾಜ್ ಅಂತ. ನನ್ನ ಏಜ್ ಬಂದು ಈಗ 74 ಇಯರ್ಸ್. ನನಗೆ ಕಾಲು ತುಂಬ ಪ್ರಾಬ್ಲಮ್ ಇತ್ತು, ನಡೆಯೋಕ್ಕಾಗ್ತಾ ಇರಲಿಲ್ಲ. ಆದ್ದರಿಂದ ನಾನು ಇದು ಆಪ್ರೇಷನ್ ಮಾಡಿಸ್ಕೊಂಡೆ. ಫಸ್ಟು ಮನೆಯಲ್ಲಿ ಏನಾಗ್ತಿತ್ತು ಅಂದರೆ ಸಪೋರ್ಟ್ ಇಲ್ಲದೆ ನಡೆಯೋಕ್ಕಾಗ್ತಿರ್ಲಿಲ್ಲ, ಆ ಥರ ಸ್ಟೇಜಿಗೆ ಬಂದಿತ್ತು. ಆಮೇಲೆ ನನಗೆ ಏಜ್ ಆಗಿದೆ, ಮಾಡಿಸ್ಕೊಡೋದು ಬೇಡ ಅಂತ ಡಿಸಿಷನ್ ತೊಗೊಂಡಿದ್ದೆ. ಆಮೇಲೆ ಯಾರೋ ಹೇಳಿದ್ರು ಹರ್ಷ ಡಾಕ್ಟರ್ ತುಂಬ ಚೆನ್ನಾಗಿ ನೋಡ್ತಾರೆ ಅಂತ. ಇಲ್ಲಿ ನಾನು ಬಂದಾಗ ಅವ್ರ ಅಡ್ವೈಸು ಎಲ್ಲ ಕೇಳಿ ನಾನೇ ಧೈರ್ಯ ಮಾಡಿ ಆಪ್ರೇಷನ್ ಮಾಡಿಸ್ಕೊಂಡೆ. ಮತ್ತು ಇಲ್ಲಿ ಸೇರಿದ ಮೇಲೂ ಅಷ್ಟೇ ಟ್ರೀಟ್ಮೆಂಟ್ ಎಲ್ಲ ತುಂಬ ಚೆನ್ನಾಗಿತ್ತು. ಹರ್ಷ ಡಾಕ್ಟ್ರು ನನಗೆ ತುಂಬ ಚೆನ್ನಾಗಿ ಇದು ಮಾಡಿದ್ರು. ಆಪ್ರೇಷನ್ ಆದಾಗ ಇವತ್ತಿಗೆ 17 ದಿವಸ ಆಯಿತು. ಈಗ ನಾನು ವಾಕರ್ ಇಲ್ಲದೆ ನಡೀತೀನಿ, ಏನು ಸಪೋರ್ಟ್ ಇಲ್ಲದೆ ನಡೀತಾ ಇದ್ದೀನಿ. ಏನು ತೊಂದರೆ ಇಲ್ಲ. ಡಾಕ್ಟ್ರ್ ಅದೇ ಖುಷಿಪಟ್ಟರು, ಇಷ್ಟು ಬೇಗ ನೀನು ಕ್ಲೀನಾಗಿ ನಡೀತಾ ಇದೆಯಲ್ಲಮ್ಮ ಅಂತ. ಡಾಕ್ಟರ್ ನನ್ನ ಅಡ್ವೈಸ್ ಮಾಡಿದ್ದಕ್ಕೆ ನಾನು ಅಂದ್ಕೊಂಡಿದ್ದೀನಿ ಮಾಡಿಸ್ಕೋಬೇಕು ಅಂತ. ಮತ್ತು ಅಸಿಸ್ಟೆಂಟ್ ಡಾಕ್ಟ್ರುಗಳು ಎಲ್ಲರೂ ತುಂಬ ಚೆನ್ನಾಗಿ ನೋಡಿಕೊಂಡ್ರು, ಯಾವುದೂ ಏನೂ ಪ್ರಾಬ್ಲಮ್ ಆಗಲಿಲ್ಲ ನನಗೆ. ಅದರಿಂದ ನಾನು ಡಾಕ್ಟ್ರು ತುಂಬ ಚೆನ್ನಾಗಿ ಮಾಡಿದ್ದಾರೆ ಅಂತ ನಾನು ಬೇರೆಯವ್ರಿಗೂ ಎಲ್ಲ ಹೇಳ್ತಾ ಇದ್ದೀನಿ, ಅಲ್ಲಿ ಹೋಗಿ ಟ್ರೀಟ್ಮೆಂಟ್ ತೊಗೊಳ್ಳಿ, ಟ್ರೀಟ್ಮೆಂಟ್ ತುಂಬ ಚೆನ್ನಾಗಿದೆ ಈ ಹಾಸ್ಪಿಟ್ಲಲ್ಲಿ ಅಂತ ಹೇಳ್ತಾ ಇದ್ದೀನಿ.